In the past, people ask me, it says, Denny, are you practicing Qigong? And I would say, well, if you write the word Qi and Gong, Qi means energy, Gong means practice. Yes, I am practicing Qi. However, you're very careful about the word Qigong itself because it's a term that was invented by the communists. It's a very modern term. It means only the exercise. Whereas what I do is much more about the mind. So I said something like, yes, I practice Qi as a journey, not as a destination. My ultimate destination for my journey is the mind. That's why I call this the mindful Qi therapy. In the past, people ask me, says, well, when we finally sit down and we're calming our body, my mind is everywhere. It's actually quite disturbing. And I would have to remind them that the meditation doesn't start when you sit down. The meditation starts 12 minutes ago. It's just that typically people think about meditation as a static posture. You sit, you stand, you're lying down. Whereas what we do here is, in addition to the static position, we also talk about dynamic. We can actually meditate while we're doing exercise. We can meditate while we walk, while we wash dishes, while we do all kinds of things. The difference is where you anchor your mind. When you're sitting, lying down, and standing, you anchor your mind on your breath. Try to stay away from your nostril. Try to focus on your element. Whereas when you do the exercise or when you're walking, you anchor your mind onto your body. Okay? So don't wait for an hour later when we sit to think that that's when we start meditation. We started meditation 12 minutes ago. And that's why I keep asking you to focus your mind onto your body, focus your mind onto the center of your arm, the hand, okay? Now, there's an addition to that, there's another reason why you want to anchor your mind, whether you anchor on your body or anchor on your breath, is that you want to separate the reaction from your body versus the reaction from your mind. And I use the simple term, figure out the difference between pain and suffering. Pain is very physical. So when we open the shoulder, we feel the pain, we embrace the pain, we examine the pain, and now we have to let go of the pain. Let go of the pain means that don't let your mind drift away following the effect of the pain, but rather keep coming back to the body. Let go of the pain. Don't let it metastasize the suffering. So that's where the mindfulness comes from, okay? Completely relax. Relax some more. And the way to relax is not to tell your brain to relax. It's actually giving your brain a vacation, okay? So you can't tell it to say, keep coming to work, but you want to relax. That's a vacation. That is not a vacation. A vacation means that you want to tell the brain to go and rest. So what you do is you give it something else to do. You tell the brain to come back to your breath, one breath at a time. I know I'm breathing in. I know I'm breathing out. I know I'm breathing in. I know I'm breathing out. Okay, that's how you relax, okay? Now, so what we did is actually we're clearing the energy lines, okay? We're clearing the energy lines. And there's 6 energy lines, 3 yin, 3 yang, 6 more that goes to the toes. Altogether 12. Each one is 2 hours of the day, making it 24 hours of the day. All that come together in here and in the back. So there's another energy loop that goes to the most important extremity, which is the top of the head, right? The finger's extremity, but think about the head as an extremity. So the yin energy is in the front and the yang energy is in the back. The yin energy, in a way, you can, if I borrow the word natal, as natal in the Western concept is the time that we were born. But if I want to borrow the word and use it to signify the time when you actually started to develop your own independent organ. What do I mean by that? The organs in the front are the yin organ. They're what we call the treasure organs. They're solid. They contain all the vitality in you that were given to you by your mother. Okay? The yang organs, the ones that are associated in the back, are what we call the vessel organ. They're the ones that allows you to consume nutrients from the outside, whether it's oxygen or food, and digest it, and then eventually manage the waste and all that. So they're called the vessel organ, vessel like empty vessel. So what's in the front are the 5 organs, or the 6 if you want to split the heart into 2. So what are they? So they are the heart, the pericardium, that's 2, that has to do with the heart, and then the lung, and then the spleen, and then the liver and the kidney. Okay, and they represent the 5 elements, and I'm going to talk about that at the end of class. The 5 elements. The 5 elements are the water, the wood, the fire, the earth, and then also the mineral. Okay, now so this is a very important part. This is a very, very important energy line. The back of of your body are the yang organs. So each one is associated. So for the heart, there's a small intestines. For the lung, there's a large intestines. For the pericardium, there's something called the triple warmer. Okay. For the spleen, there's the stomach, and for the liver, there's the gallbladder, and for the kidney, there's the bladder. Okay. Again, these are abstraction. These are just energy lines that we name it after some organ. All right. So what is qi? What is the qi? Well, you say, well, that's bioenergy, right? That's the energy of the body. So what is that? Well, all energy is either electricity or magnetism, and the body is a biochemical factory, right? It's all chemistry. So these chemicals are traveling through a body. They carry electricity, and the thing that is ignored by the Westerner is that as electricity travels, it generates magnetism. And so when we talk about qi, it's really electromagnetism in the body. And when you have magnetic field in your body, you have these energy points. They're like the dipoles, okay? And so now what we want to do is we want to work on these energy points. That's why I call it qi intervention. Open the shoulder, making sure that all we're trying to do is clear that energy field in the body. Clear the energy field in the body. The body is fully capable of self-healing if you give it a chance, all right? The Chinese has a very good saying, it's thousands of years old, that talks about healing. How it talks about the 3 levels of healing. It says that the lowest form of healing is when you're sick. So when you go to a doctor, you have a problem that is acute, the doctor prescribes some medicine, and you're cured, or at least of the symptom. So the Chinese believe that that is the lowest form of healing. The middle form of healing is when you feel that you're about to get sick. Okay, a good example of that is, let me back up a little bit. So one of my uncle actually, recently, a few years back, had a cancerous liver. He lives in Hong Kong, and they did a surgery on him to remove half of his liver and let it grow back, right, by harnessing the healthy half. It's a very complicated exercise, and I was at awe how complex it is. And I don't remember reading about that in the States. I don't remember reading about complicated surgery like that. And the reason is that we don't practice that much. We don't actually have to cure cancer patients at the end stage that often. We usually cure them at the early stage because we have a reasonably good medical system, health system, and we're able to detect disease before it metastasizes. So the Chinese believe that the middle level of healing is when you're just about to detect the onset. That's the middle, not when it gets to the end stage. So then what is the highest form of healing? The highest form of healing is before, way before you get sick. Way before. In other words, what we do here is not to replace the doctor. So people complain about this and that, and that's an acute problem. Go to the doctor. Go to the doctor. Get the right kind of medicine. Give yourself some comfort. Okay? And then go back into a regimen where you do regular checkup. So now you cover both the lowest form and the middle form. What we do here is the highest form, which is we want to maintain the harmony in the body, maintaining the harmony between the 5 elements, between the harmony between the yin and the yang, maintaining the qi, We do all that to prevent sickness. That's the highest form of healing, is self-healing. Okay? So one of the form of self-healing is really understanding how the heart and the lung works with the kidney and the bladder. So I talk about how the body, upper torso, is divided into three. There's the heart and the lung, and then there's the kidney and the gallbladder. All right. So the Chinese actually talk about that, and I talked about this in the past, that they actually gave it the description. They said the upper body, the upper torso is like the fog. The lung and the heart is the one is dealing with the outside, absorbing the oxygens and the nutrient, and then now it's going to distribute that into the rest of the body, like the fog will moisturize the earth. The middle part, the stomach and the rest of it, is like the foam, meaning that when you make beer or you make ferment anything, it has some foam, right? So this is all about fermentation. And then it says the lower part is about the gutter, as if you have to reclaim any nutrient before it goes to waste. So that's what they think about the kidney and the bladder. Now, when they talk about self-healing, maintaining the harmony of the body before you get sick, it's about maintaining the harmony between the upper torso, upper part, and the lower part. The upper part is fire. Okay, the lower part is water. So there's a bunch of exercise that makes sure that there's harmony between the water and the fire by working on the middle. Okay, so the next exercise is about that. It's about water and fire. So we now open the shoulder, stretch your spine, relax. We're going to take the right hand, using the center of the palm, reach as far back as you can. There's an energy point here that is associated with the heart, that's fire. And then we're going to take the other hand, use the back. Now, it's right behind the belly button, but on that side. Okay, so that's covering the kidney, the adrenal gland. Okay, so this is a vertical windmill, mixing water and fire. So you need to rotate your body a little bit, okay, as you do that. The Chinese doctors, they continuously discover new energy points. Then these they name them like the way you discover planets. They name them after themselves. And then, but these energy points that they discover, not just in the ear, but the rest of the body, are outside of the 12 energy lines, the 12 meridians. And so you would think, why is that? You know, I would think that the 12 energy lines is all encompassing, so all the energy point has to associate that. What you have to understand is where all that knowledge came from. All that knowledge came from deep meditation. Is when you meditate and you're letting go of your body, you start to really experience the duality, the particle wave duality, that what you think is body, what you think is particle is actually wave. You start to experience your body as just energy. And those 12 meridians are the energy that exists in your body. And you can only experience it with deep meditation. Where did they learn that? Where does the Chinese learn that? The Chinese learned that from Bodhidharma, who was a yogi who visited China in the 16th century, 14th, 16th century. And the Bodhidharma was a yogi. Who was Bodhidharma's original teacher? Well, you say it's original Buddha, right? In Sycamore. Well, who was Sycamore's original teacher? Sycamore was yogi too. So the original yogi teacher is Shiva. And in his time, he talks about 72,000 energy points. Right? The Chinese abstract that into 12. That doesn't mean that there's only 12. The body is full of energy. And so these energy points are actually outside of the 12, but they're very important, okay? There's over 100 energy points in your ear, all right? So the two things that we do here, impacting the bottom of your feet, and this one, these are very old technique, and they came from the Tang Dynasty, okay? So I noticed that there was a question, may I ask whether there's a way of qi generation? You don't generate qi. Qi is already in you. You just have to release it. Okay? So this is not something that you can just take a pill and get more of. This is really about you got what you got, and now it's just making best use of it. All right. So all these exercises that we have done until now, working on the body, the chi, and most importantly on the mind, anchoring the mind on the body, anchoring the mind on the breath, is actually a way of making better use of what we already have. All right. The chi, it comes from the universe. You're part of the universe. You just have to make use of that. It's already in you. Okay? All right, so now we're going to do the sitting meditation. The sitting meditation is, we do this for therapeutic reason, right? It's part of a chi therapy. This is done in 3 parts. First part is the posture. So let me once again go back to the posture. If you're sitting on a chair, make sure you don't lean back onto the back of the chair. Make sure your feet are firmly on the ground. If you sit like I do and your knees are like this, make sure you put some pillow. Okay? So you're not using muscle. You just let the body rest on its own skeleton. Okay? Otherwise, if you could, have it firmly on the ground. The hands just relax. Okay? If you have to do mudra, that's okay. All right? But otherwise, just relax. Then we come to the spine. Stretch the spine as if somebody is grabbing the hair and just hanging the spine from the ceiling. Okay? Then we're going to take a shoulder. And now that you're familiar with the energy points, front, back, and the top. So what you want to do is you want to open the shoulder. And now you want to relax the shoulder. And you feel the pressure both in front and in the back, and you find that balance. Then you take your forehead and you lean back, putting the weight of your head on your spine. You go as far back as you can until the neck touches the collar. Then you take your chin, you lower your chin, you tuck in your chin. So now you notice that the energy points, if you were to go from the ear up, this is now pointing to the heaven, and it's directly on your spine. Okay? Now you take your entire upper torso, you lean forward, and then you lean back. But as you lean back, you keep your hip in place, so you feel some stress on these 2 energy points that is directly above the adrenal gland. Okay? Maintaining pressure on that. Now you go to your eyelid. You don't open your eye like this. You don't close it like this. You leave one open. Now, in my case, I compromise. I actually open one eye and close one. I open my eyes just so slightly. I can see my own eyelashes. I can see my hand and my knee. And I just relax. Now you take the tip of the tongue and you just let the tip of the tongue touch the roof of your mouth, where the roof of the mouth meets the teeth. Why do you need to do that? The baby does that. If you ever have a baby, a newborn baby, pry open the lip, you see that the tongue is touching like that. Why? Because when the baby is inside the mother's womb, he or she has to maintain the energy. And the tongue has to touch the back of this point, because this is the beginning of the yang energy line. It's also the beginning of the yin energy line. It's where the 2 meet. So we need to form a bridge, an electrical bridge. Okay? All right, now this is part 1. This is what we call the pillar, 1 pillar supporting the sky. Okay? And this is already very relaxing. Make sure you lean back slightly, so you're taking the weight off of your body, off your muscle, back muscle. The second one, now that we have done almost half an hour breathing exercise, I want you to come back to your breathing. And if you say, well, I don't feel it anymore, it's already, my body cooled down. Okay, that's okay. Just come back. Now this time, I'm going to allow you to open your mouth. Open your mouth and blow air through your mouth. Blow air through your mouth very gently. You feel your stomach is collapsing. Blow as hard as you can, as much as you can, not just very gently. And then relax. Feel the air coming in through your nostril. Feel your stomach is expanding. Second time, blow air through your mouth. Feel your stomach collapsing. Relax. Feel your stomach expanding. One more time. Blow air through your mouth. And relax. Now, remember that feeling. Close your mouth. Focus on your breath. As soon as you know that you're breathing in, open that stomach. Don't suck air through your nostril, just open that stomach. Open the stomach as if you're opening a bellow, okay? And then the air will come in naturally. And then as soon as you feel that you have an urge to breathe out, collapse the stomach. Squeeze the air out into your nostril. Don't suck it with your nostril, okay? Very gently open your stomach, breathe in. Very gently collapse your stomach, breathe out. Focus on your breath, focus on your stomach. So the first part is the posture. We call that the one pillar supporting the sky. The second part is when you do deep breathing like this, we call this the exchange of the cloud and the fog, right? So you breathe out, that's like breathing out the cloud. You breathe in, that's like breathing in the fog. You're exchanging that with the universe. Completely focus on your breath. Know that you're breathing in, open the stomach. Know that you're breathing out, collapse the stomach. Now I want you to come back, maintain this posture, starting with the feet firmly on the ground, then to the hands, relax the hands, then to the spine, then to the shoulder, then to the forehead, then to the chin, then to the eyelid, then to the tip of the tongue, and then come back to the breath. In, open the stomach. Out, empty the stomach. All right, so it's 2 hours and 15 minutes. That's a long, long practice. And surprisingly, some of you are still here. All right. So let me see if I can answer this. I can't answer the questions all the way in the back. Hey, Josh.
Hey, how's it going? We got a couple questions here.
Yeah. I can't. It's not possible for me to go back. So just tell me what they are.
Sure. Yes. Let's start from the beginning. Let's see here. It says, "Good morning. I had a bump at the neck on the right side, which I always attributed to carrying a heavy bag on my right side. Well, dang it. when somebody texts, then I can't. Okay. How does reduce the bump as it hurts if I pressed on it hard? So I guess she has a bump on her neck, and when she presses on it, it hurts, and she thinks it comes from carrying a bag on the other side.
Yeah, I'm not 100% sure. If you have hurt, if actually there's damage into your muscle, then you need to fix that. Okay, so if there's anything that's acute, you need to fix it first. But having said that, I think a lot of our pain. So this is my belief. This is my belief is that when we talk about qi, in English is one word. In Chinese is many variations of that, depending on what word you conjugate it with. So the most basic form of qi is what we call shi qi, blood and qi. Right? Blood is basically the circulation. So if you have any kind of swelling, we think that is because the blood is not circulating properly. But if you have any kind of pain, then it's the qi that is not circulating. So the exercise that we do in the first half of the class is very good, especially the fingers. The fingers are actually very good in clearing the qi. But at the same time, if you actually feel that you have hurt your muscle, then I would figure out how to fix that first. Okay.
Okay, Denny. The other one early on was Amy's comment. Denny, my doctor thinks I have a cerebral spinal fluid leak in my brain. The cerebral spine is degenerative. I have a connective tissue disease. Any of this apply energetically, spiritually to you? It's my 51st birthday today. I want to feel some agency and not victimized by this illness. I appreciate a brief moment of your wisdom."
I would not give up. I don't give up. I have to take care of my parents. I believe in Western medicine. I don't compromise on that. And so I listen to the doctor. The only difference is that I become their prime contractor and I think of the doctor as the subcontractor. So each one of them gives me advice and I try to follow them, but at the same time try to find a balance between the different approach. So if you're under the care of a Western doctor, I definitely will listen to them. But at the same time, I think doctors tend to focus on the symptoms and they think of the body as just a collection of individual working parts. Parts are related to each other through chemistry, and they fix it with chemistry, otherwise known as pills. I think that's fine. We need to really do that. But I think what we try to do here is to really explore on your own, giving you a way to explore on your own that there could be other dimensions of existence, meaning that if you improve your circulation, that's going to be good for you, right? If you do meditation, try to find a balance between the stress, the emotional stress that are trapped into your body, let them kind of relax and release. That's got to be good for you, right? So I would definitely, and this is a very generic answer, and the same thing I said to my mom. Okay, if the doctor thinks that he needs to operate on you, relieve a pinched nerve, let's do that, right? Fix that first. But at the same time, we need to work on this exercise. I started this exercise 3-4 years ago, mainly to help with my mom. And she used to have arthritis. She used to have all kinds of problems. And if you can see her, she's not here anymore, but she needs to go back to take care of my dad. She doesn't have any problem anymore just by doing this exercise. So both my parents are living examples of the beneficiary. I myself is a beneficiary. But you have to take the long-term view. This is a long-term view. This is really working on chronic problems, not acute problems, okay? And I think now is a good time to talk about something else because everybody worries about the variants, Omicron and Delta and all that. And I think that's a misplaced attention because virus is variant. So you can't just say, oh, here comes a variant, how sad it is, let's focus on that. No, virus is a variant. Virus have no life form. It's not a life form. It's an energy. It's an energy in the universe. It's an energy that is incompatible with our energy. Okay? Now, I'll give you the virus that we have causing the disease in the body started about 20,000 years ago, when we start to domesticate animals. But the virus that we have today started about 65 years ago, started basically when I was born, and it comes from the wild animals. It's the universe telling us that we are not compatible, right? We are no longer maintaining the harmony. And so I'm not saying that we shouldn't try to take, booster shots and all that, but I find it ironic that when we talk about antibodies, we know enough not to take so much antibodies that is bad for us, right? We know enough not to choose the right kind of meat because the meats are full of antibiotics. But antibiotics is about germs. Now we talk about virus, which is a very different thing. And yet we don't have the discussion about why maybe we shouldn't take so much of it. Then you say, well, are you against insulin? No, I'm not at all. I absolutely make sure that I have all the right shots. All I'm saying is that let's go back to 4,000 years ago, how the Chinese think about, how the ancient people think about virus. They think of it as bad energy. And they're saying that the way to combat the bad energy is with good energy. And now, obviously, we now call that the what do we call that? We call this the immune system, right? But the word immunity doesn't exist actually in the Chinese literature. It's just right qi, proper qi, right qi, proper qi. And so, I believe that the body is capable of self-healing and protecting itself, and so I think now is the time to focus on that, to really understand that, experience the chi, to experience the health benefit you get by actually working on the chi. That's all. That's all. That's what I believe. Okay.
I was going to say that too, Denny. Today's practice was especially balanced and harmonious. And yes, we can be proactive in our health too, not just reactive. So there's three more questions here, really short ones. This one I think actually might be decent to mention on the next Ask Us Anything, perhaps. Can you talk about the healing property of the palm energy or do a class on it?
So I talk about my dad being bedridden, but that's only a month ago. A month ago, it deteriorated to a point now he's completely bedridden. But before that, he was able to walk and be more or less functional. Except the problem then is that sometimes his mind, now when I look back, I understand why, because he doesn't recognize it as, so he thinks that he's in somebody's home and he keep wanting to go back to his family. And so he doesn't always listen to what we say. And so we ask him to walk with the walkers. He doesn't. He has his own way. And one day my mom called me and he says, Denny, you need to come over right now. I said, yeah, I know, I'm coming over. No, you need to come over now. And so I come over and my dad is on the floor. And it turns out that he was actually using his stroller and my mom was helping him to go to his bedroom. He was actually in very good shape. We were very happy about the progress he was making. And my mom decided that she would walk in front of him to turn on the light in the hallway. And my dad at the same time decided that he wants to go back and turn off the light in the living room. And he actually walked away without using his stroller and he fall onto the ground on his back. So by the time I got there, he had a little bump, his big bump on his back of the head, but I didn't feel like sending him to to the hospital. He was okay. So I tried to ask him if he could sit up because it's very difficult to lift him up. He needs to help me by grabbing onto the pole and then together we can lift him up. And he couldn't sit. He said, yeah, it hurts. So I look at his back and there was a protrusion. Like triangle. I swear to God, there was a protrusion from the back of it. And I was, oh, that's really bad. And so I finally figured a way where I use a blanket and I just let him lay on the blanket. And I use the blanket, I pull the blanket all the way to his bedroom where there's another pole where he could grab lower, and then slowly we bring him back in his bed and the protrusion was still there. And I said to myself, all these teaching that I do about the energy coming up from the hand, now is the time. So I completely focus on myself. And of course it helps that I'm thinking about Guan Yin and all that because she has the power to heal. And I just completely focus on this hand and I just massage his back, right? Because this is the only thing I have is to believe in the center of the palm, which has an interesting name called the Palace of Labor, and believe in the teaching that this is the point where you can put out energy. And I use all the positive energy I have, which means that I was completely focused on my body, completely staying away from any bad energy that I have, and I just keep massaging his back. And I look down, and the protrusion is gone. I don't know. It works.
That's awesome, Denny. You know, just as a baseline, all of us here, when we hurt ourselves or bump ourselves or maybe scratch ourselves, what's some of the first instincts we do, we're not even thinking about it, is we put our hand on it, right? And you can look at all these Tai Chi masters on YouTube and the healing properties they do with their hands too. I mean, some of them are charlatans, but some of them are fairly legitimate. It seemed that way in my experience. Yeah. Okay, so this next one is, this might be off subject, but what are your thoughts on drinking coffee? I ask because I know it affects our kidneys, adrenal, etc. And Denny's talked about this, but he can reiterate.
Well, I think there are things that you do that are absolutely bad for you and you shouldn't be doing it. And then I think there are things that you do that at the right amount, that there's some health benefit. I think for every paper that you can read about the ill effect that coffee brings to your body, I can give you half a dozen articles that talks about the health benefit of coffee. I drink coffee. That's my first drink of the day. And usually I drink another one during the middle of the day, but I don't drink 5 a day. I don't drink one every hour. People talk about tea as having benefit, but I bet you if that's all you drink, then that's a lot of stress on your kidney too, right? So I think the right answer is, now that you're in this class, now that you have this opportunity to learn together, I think now it's time for you to really experience your body and let your body talk to you. A couple Tuesday ago, Josh and I had a conversation with Lydia, and we talked about how it is important to let your body speak. Your body speaks to you all the time, but you are not capable of listening to your body. Why? I talk about the sun and the cloud. I talk about the sun being the good energy and the cloud being the dark energy. And I talk about how on a good day like today, when you look out the window, you see the sun. On a bad day like yesterday, you don't see the sun because the cloud is there. The sun is still there. So I think we have positive energies, just like earlier, how do you generate chi? And I said, well, you already have the chi. It's just that you just have to learn to make better use of it. So I believe that we have positive energy in us. But we're not capable of interacting or taking benefit of this positive energy. We have this black cloud. The black cloud is your emotion, is your attachment, is your aversion. It's all of that. And so this class is ultimately, that's why the word mindful is important, is once you know how to anchor your mind onto the center of your hand, anchor your mind onto the center of your feet, anchor your mind onto your breath, you have a new technique to push away the black cloud and let the positive energy come up. And if you let the positive energy come up, you can now listen to your body talking to you. And your body will tell you that maybe 5 coffee a day is too much. Maybe 1 coffee a day is just the right amount. The body will tell you. You just have to learn to listen to your body as much as you learn to listen to your doctor. Okay.
One way I look at it too is as medicine. So if there's something I'm questioning about, am I doing too much or too little? But then if I look at it as a medicine, this works on some things, not everything. But okay, I think the last one is by Lunar, who's got a bunch of questions today. Good questions too. Can you strengthen chi with a rubber stretching band? So can you strengthen chi with a rubber stretching band?
You strengthen chi with your mind. You strengthen the physical body with the rubber band. I think don't mix the two, okay? Okay, don't mix the two. There's energy that has to do with the biochemistry of your body, right? So if you use a rubber band, that definitely would help. But that's the physical part of your body. We're not talking about the physical part of your body. We're talking about an independent system, another dimension of your existence that has the energy that we can experience only through our body. Only through our body. All right? So does the rubber band helps? I don't think it will hurt, but I guarantee you what helps is really the mind. The mind helps, right? The mind helps. I'll give you an example, right? I talk about yoga. The original word is yuj, Y-U-J. It means the harness. It means the bridge. It means the things that connects the mind and the body. So when it comes to China, we call that the qi. But the qi is like the Golden Gate Bridge that connects the 2 pillars. And when they built the Golden Gate Bridge, they built it independently. Okay? They build like this and they build like this. But imagine what would happen if one side is doing one thing and one side do another thing. It goes like this. Then you have two bridges. So the idea that you have to maintain synchronicity with your body and mind using your chi, that is fundamental. That is fundamental, right? So that's why I emphasize the mind when you work on the energy point. Think of your body as an instrument. Think of it as like a drum, and you listen to it. You listen to it. You listen to it. You bring your mind and your body together.